The usage of hard drugs, including alcohol, by adolescents and young adults before engaging in unprotected sexual activities has been identified as a major contributing factor to the high prevalence of HIV in Nigeria. At an HIV media dialogue, experts emphasized the necessity of early testing, high-quality treatment and care for infants, children and adolescents living with or exposed to HIV. Correspondent John Felix completes the story.
Tuberculosis, a lung disease that afflicts millions of people worldwide, is dangerously on the march in Nigeria. A new report by the National Tuberculosis and Leprosy Control Program noted that Nigeria alone accounted for 23% of deaths resulting from TB in Africa. The report states that undetected TB carriers in the country are capable of infecting between 12% and 15% of the country's population annually. This is disturbing primarily as other diseases like Lassa fever, malaria and meningitis are ravaging Africa's most populous country.
Usually, by the WHO report of 2023, Nigeria was ranked 6th in the world and is first in Africa in terms of TB burden. And we have successfully been able to notify over 300,000 TB cases last year, 2023. So efforts have been...
Like, we're expected that for the total number of tuberculosis cases that we report in Nigeria, that 12% of them should be childhood TB. But currently, we have like 9 to 10%. Initially, we are like 5%, but with all the effort that has gone into Child Testing Week, focusing, looking for where the children that are most vulnerable for TB are, and going to take the services to them.
According to a report, Nigeria has a huge funding gap as 70% of the TB budget is not funded, adding that the country requires $300 million to bridge the gap. For Nigeria, this is a massive sum in an era of naira depreciation. In an updated list released in June 2021, Nigeria remained among the 30 countries named by the World Health Organization as high-burden countries for TB, along with several countries.
The message also to the media is that they need to encourage people that if anybody in their household is diagnosed with tuberculosis, they themselves need to also come out for screening. When they come out for screening, we are also able to put them on preventive treatments.
What then should be the preoccupation of government at all levels and other stakeholders in curtailing the menace of tuberculosis?
It's more that the government and partners, they need to do with media, building their capacity on knowing more about TB in children, how children get infected, how children can be protected when their parents or their caregivers have tuberculosis, how children can be tested,